what does it mean when we say that healthcare is 18% of GDP? The governments at all levels spend about 52% of that 18%. And it's $3.3 trillion a year. The entire federal budget is about $3.5 trillion. So, what we saw was that the national defense, which was at one point, maybe 10 years ago, equivalent with healthcare in the federal budget, has now been eclipsed by healthcare. National defense is around, I guess, maybe 16%, and healthcare is 27, 28% of the budget. I mean, it's crazy, and healthcare is growing faster and is out of control. So that was one aspect of it. And then we looked at our expenditures, more closely, because we get those reports from our insurance company. What are we spending the money on? Well, I had a couple of our employees who had hepatitis C, and they were paying $84,000, $1,000 a pill for this miracle cure, which in one case wasn't such a miracle. It took 2 sets of doses for one employee, and then the other employee required some additional medications. So we were spending $300,000-$400,000 for one illness, and then we were looking at pharmaceuticals. Pharmaceuticals ended up being 30%, 33% of our overall spend, and we looked at specialty drugs, the rise of specialty drugs. 15 years ago we had 10 specialty drugs. We now have 300, and the specialty drugs are incredibly expensive. And they don't have to be, because we looked at the research in that. I guess we're getting into pharmaceuticals, but we looked at where does the research dollars? The federal government spends $32 billion on basic biomedical research, and the pharmaceutical companies, by law, can take that research, commercialize it, patent it, and charge extraordinary prices. And so not only is the government spending the $32 billion to develop the drugs, they're also spending extraordinary amounts of money to pay for individuals in our society to receive the drugs. So they're paying twice.
Wow.
So, we met with economists, we met with activist doctors, we filmed in Canada, we looked at Taiwan and Europe's operations, and so we really got a very broad base of research and interview to make this movie. And we concluded that single payer certainly is the most efficient way to do it. And I'm a business person, following basic business practice. I want to eliminate all these middlemen. I want lean manufacturing. I want transparency in a system which we don't have. If you apply all these basic principles, which are sort of inherent in a single payer model, you can save tremendous amounts of money. What we project that we can save is upwards of $700 billion a year. And if we provided health care for all, and if we reduced the levels of deductibles and made the system more usable and fair for workers and their families and all individuals in societies to use, it might cost us another $200 billion to do that.
So
so the net is $500 billion in savings.
Yeah.
$500 billion in savings for a Medicare for All program in the United States.
As we continue to explore conscious solutions to our world's most pressing problems, Be a part of the conversation and subscribe to our Karma Talks channel. Thank you.